About 16 million Americans suffer from a major depressive disorder, and nearly a third don't find relief from traditional treatments. On this week's edition of Today's Health, we find that an old drug may offer hope for people who struggle to feel better. Reporter Megan Ruther has a story.
Come on, baby.
It hasn't always been easy for Cassie Smith to find joy.
I was miserable and having a hard time functioning in daily life.
She suffers from PTSD and chronic depression. Medication and therapy weren't working.
My senses were so dull from the depression that I just wasn't aware of my surroundings. I couldn't look at my children and see how incredible and beautiful they were. I was just numb to most pleasant emotions.
Have a seat in the usual spot.
Then she found the Iowa Ketamine Clinic. Dr. Alan Young isn't a psychiatrist, he's an anesthesiologist, and the treatment isn't a pill.
Usually what happens is the psychiatrist has tried everything on this patient, all the drugs that they usually use. The patient doesn't have a satisfactory result, and they say, well, why don't you try ketamine? It's a new thing.
Ketamine has been used in anesthesia since the early 70s. The FDA has not approved it to be used for depression, but the agency is fast-tracking 2 forms.
It's a off-label use of the drug, which means it's perfectly legal to use it, but they don't recognize it for depression, and the big problem with that is insurance companies won't cover it.
Ketamine is administered through an IV while the patient is monitored. Each infusion takes about 40 minutes and costs $500 at the Iowa Ketamine Clinic. Patients need about 6 in a 2-week period and then boosters after that. Doctors say more studies need to be done, but the drug seems to work quickly and help patients who haven't gotten better with other treatments.
Ketamine's probably the most exciting breakthrough in the treatment of major depressive disorder that we've had in perhaps 50 years.
Smith still sees her psychiatrist, but says this treatment gave her a new lease on life.
I feel incredible. I feel amazing. I feel like I can finally enjoy my great job, my great husband, my incredible kids. You know, it's wonderful.
As she enjoys the simple pleasures of life.
Bambi, you crazy girl.
Ketamine has also been used as a recreational street drug called Special K. It should only be used under a doctor's supervision. It's unclear how long any benefit of treatment might last. In other health news this morning, white children with developmental delays are more likely than minority children to get help with their language, motor, or cognitive skills. Researchers at the University of Colorado, Denver say fewer than 25% of minority children eligible for services use them. To study the phenomenon, study authors interviewed 22 Black and Hispanic mothers. The moms said they often received conflicting information about interventions and sometimes felt pressured into using them. Financial stresses were also a concern. Sometimes parents are concerned their kids aren't growing fast enough. The American Academy of Pediatrics says testing those children is often unnecessary. The experts suggest pediatricians think twice before screening for endocrine or thyroid disorders in kids who are simply short. Such tests diagnose new conditions about 1% of the time. The important thing is to make sure the child is following his or her own curve. The AAP also advises against routine vitamin D screening in otherwise healthy children. This includes overweight or obese kids who often have low vitamin D levels. Pediatricians say screening should be reserved for young children who have low levels of bone mass or have a history of broken bones. That's it for this week's edition of Today's Health. And coming up on KPVI News Today, we take a look at your KPVI News Today headlines.